Okay, guys, this is Dr. Sean over at Natural BodyWorks, Fortis College. This is Medical Terminology 105, OAHP 105. This is Mastering Healthcare and Healthcare Terminology, 6th edition. Betsy Shiland is the author, and we're going right up here with the whole PowerPoint. This is a one-take thing, guys. We're going to go right through it. This week, we're going to do what is it? Chapter 5, Gastrointestinal. This is part 1, 2, 3, 4, 5, 6, 7, 8, 7, 6, 7. I think it's part 7. Anyways, week 4. This is week 4, part 1 of week 4. This is chapter 5, gastrointestinal system. This is kind of a nice one. In this one, we'll recognize news terms related to anatomy and physiology of the gastrointestinal system. When we're talking gastrointestinal, we're talking about the stomach and all of the guts and everything, usually even from the mouth all the way through to the anus, the other side. So the gastrointestinal tract, there it is, the alimentary canal, ALI. Okay, alimentary canal. That's basically the entire thing from lips all the way to anus. That goes all the way through. So we're going to go oral pharynx, we're going to go esophagus, stomach, small intestine, large intestine, and all the way out through the rectum and everything like that. Digestive system. We'll talk about some digestive issues as well. There's some really interesting ones that you guys will probably come across. They're very, very common. One of the things we notice in digestion is because all of the organs are hollow, they tend to move things pretty quickly. It's a mucous membrane on the inside, so that's going to be your um, uh, um, there's serous fluid made, of course, on the outside of it, but on the inside, you're going to make mucus, okay? And that's epithelial tissue, and that regenerates pretty quickly. So a lot of problems can come and go, and we may not even notice it. So functions and specialties of this system. Oh, let's see, ingestion, that's to bring in. Now you can talk about things like mastication, which is chewing, and deglutition, which is swallowing, and then digestion, which is breaking apart, absorption, which is bringing in, and then elimination. It says defecation and feces. What else would you eliminate? I guess I mean, the defecation is the terms. So the process terms in that is ingestion is mastication is chewing. Okay, deglutition is swallowing. Then we have churning. Okay, which is there's a churning action in the stomach. And then we have digestion to break apart, okay? And so we break like proteins into amino acids, we break carbohydrates into sugars, and we break or starches into carbohydrates actually, and we break fats into like lipids and stuff. So and then we have absorption. So you absorb what's useful, and then you get rid of what you don't want, and you get rid of a lot of other stuff. We'll talk about that too. So a gastroenterologist is someone who looks inside the gut. Okay, gastroenterologists, dentists, also a specialist there, exodontists. Never even heard of an exodontist. You're probably not going to use that. You're going to lose endodontist. And a proctologist on the other end. Okay, periodontist, pedodontist. Okay, good. General description of the AI tract. So oral cavity, mediastinal cavity. We don't really say mediastinal cavity. We say it in the mediastinum. Remember, that's this area in the center of the chest. That's where we have some different parts. We have the esophagus, of course, and we have that's behind the trachea. So here's a trachea. And when we swallow, it's behind inside there is the esophagus. The esophagus is basically collapsed until something's in it. The abdominal pelvic cavity, so it goes through the thoracic cavity or the mediastinal area of the thoracic cavity, and then it goes below the diaphragm into the first part of the stomach. Then we have the mesentery. The mesenteric has to do with the gut area actually. Just trying to check some things there. So we have layers, the inner. So remember, we're talking about the inside of the tube. I don't have a tube here to show you. Do I? I've got to have something that looks like a tube. Okay, here, we'll use this. Always like examples. Okay, so this is just the cap of a pen. Okay, on the outside would be the tunica. Well, there's actually a serosa on the outside of it, and then on the inside, the first layer is going to be from the outside in is the tunica muscularis, and inside that is the submucosa and then the mucosa. The mucosa makes mucus. The submucosa holds a lot of the glands, and then the tunica, the tunic. The tunic is like a kind of like a covering, right? Is the tunica muscularis. Muscularis means this muscle, smooth muscle. Remember smooth muscle? It's involuntary, one nucleus in that, and it's smooth underneath microscope. So very rhythmic. It's called peristalsis, is the rhythmic contractions that it does. You can feel it sometimes when there's a problem. Oral cavity, stoma. So stoma means opening, right? So we would get stomas through here, right? Mastication, deglutition, we talked about that. Labio or chilio. So chilio is like more on the lips and the sides. Cheeks, the bucco or bucco, the buccinator is a muscle in through here. Glosso or lingual is the tongue. Palate is palato. So you have palatine or palate, the soft palate, which is in the far back, and then you have the hard palate. Now, if you look back inside the mouth, and you see that little punching bag thing, that's called a uvula. That's the little doodad in there. Now, what that does actually is that folds back up when you swallow to keep stuff from going back up into the nasopharynx. Incisors, cuspids, right? And then you have these are the canine teeth, okay, or eye teeth they're called, because the root of them goes way up high. The incisors in the front. Then you have the bicuspids, which means it has 2 points on it. You can see them. Let's see if we can see this guy. Nah, you really can't. So here we go. I don't know if you can see this at all, but we can see there's 1 point and another point. Those are bicuspids, so 2 cusps. And then you have the guys in the back are the molars. There's what, 20 teeth in a little kid, 32 in an adult. Okay. Deciduous means they fall out. That's baby teeth. So deciduous teeth, right? Gingiva is gum. You get gingivitis. Uvula, we talked about that. Salivary glands. Okay, so there's a parotid up here in the parotid gland. There's a sublingual underneath the tongue and a submandibular underneath here. Now the submandibular and the sublingual, those are the ones you can gleek with. There's a little gland opening right in the middle. And there's also some little tiny pits on the side. Those are for your parotid glands. Sometimes when you eat something really sour, you'll feel that and it'll squirt out a little bit. If you ever had braces, you have a little wire in the back. Every time you smile, you get caught on one of those. It's real pain. Pharynx. So we have the nasopharynx, which we've talked about, right? And we have the oropharynx and then the laryngopharynx. It's not called the hypopharynx. I've never used that before. The hypo means below the pharynx. So that's laryngopharynx, okay? Oropharynx and nasopharynx. But for this book, I think they're might use hypopharynx. I won't mark you wrong because that's not really even a word. I mean, it is a word, but it's not common enough to be used here. I don't know why they have that in here. We should change that. Esophagus. So once you chew, so when you masticate your food, you chew it up, and your tongue moves the food towards the teeth, and then the cheek muscles move it back from that area back underneath the teeth. So as the teeth come down, they can grind it. Now that makes what's called a bolus, which is, a little ball. Sometimes you see a bolus of something. They'll like use it in a syringe. You'll put a bolus of some medicine, through their IV. The bolus becomes then pushed down through here, but the tongue will push it back, and the esophagus will stretch open to receive it. Now in the laryngopharynx, you also have a flap called the epiglottis, which will close, called the guardian of the airway. It closes down so that you don't swallow stuff and it goes down your windpipe, okay? Lower esophageal sphincter, so that's at the bottom of your esophagus, right? Or the cardiac sphincter, okay? Gastroesophageal, those are all the same thing. Next thing we have is the stomach, cardia, the top part, the fundus, the main part of the body. Pylorus is the end, the rugae, and the chyme. So the stomach, I did other videos on the gastrointestinal system. You can look those up on the same what's it called, playlist. You can get the playlist and you can look up the gastrointestinal system. I'm pretty sure I did one on there, but you can look up also the rugae. So as you look at the stomach, it's kind of it's J-shaped. I wish I had my way to draw on this. Sometimes I do, but this is open in a weird way, man. I can't really open anything else in here because this is supposed to be PowerPoint, but it's not really PowerPoint because I can draw in PowerPoint. I can't draw in here. Anyway, so these rugae, okay, are the same thing on the roof of your mouth. If you put your finger on the roof of your mouth, there's these little ridges. You see a dog's mouth or something like that? It's the same thing. It's in your stomach, and what it does is two things. Increases the surface area and gives a way for the stomach as it churns to grip that bolus of food and all of the juices in there and to make it into a thing called chyme, C-H-Y-M-E. Okay, plica, the villi, small intestines, the duodenum, the jejunum, and the ileum. So the three parts. So if we look back at the stomach, you can see the pylorus. Okay, the pyloric valve is the end, and that becomes immediately the duodenum or duodenum. The duodenum is actually the technical term. That's the first part of the small intestine. Small intestine has three parts: duodenum, jejunum, and ileum. Okay. Duodenum is a very small part. It connects to the gallbladder and we connect to the pancreas and stuff like that. And then we go straight into the jejunum. That's kind of the central part. The entire system from here all the way to the anus, if you stretched it all the way, it's about 33 feet long. That's quite a long ways. The ileum is the last part, and that connects to the large intestine. And okay, so here we have that word right here. So the cecum is the first. Cecum means pouch. Is the first part on the lower right-hand quadrant, the lower right quadrant. That's where your vermiform, which means worm-like, vermiform, formed like a worm. So it looks like a little worm. That's the appendix. The ileocecal valve or the ileocecal sphincter goes from the ileum, the last part of the small intestine, to the cecum, which is the first part of the large intestine. Then you ascend. Where's my little guy? Okay, so we have on this side, so this is, put his hand behind him, we hold him here. So this is the lower right quadrant. Okay, so that's where our cecum is, and then it becomes the ascending colon, and then it turns up here. On this side, on the right side, is the liver. That's called the hepatic flexure. Okay, a corner there where the liver is. The hepatic flexure goes transverse across to the upper left quadrant. The upper left quadrant is where we have the splenic flexure. The spleen is right in this area too. And then we go descending colon, and then it makes a little loop-de-loop in through here and comes down this way. Become the sigmoid colon. Okay, so sigmoid colon, and then rectum, and then anus is the outside, the outdoor, whatever. Now that's also a sphincter. So there's two parts of that sphincter. There's an internal sphincter and an external sphincter. You have control over the external, but not the internal so much. Same thing here. We have control over this one, but not the internal ones, right? So you have how many sphincters if we count them all the way down? Technically, the mouth is a sphincter, but we have control over it, right? And then we have the cardiac sphincter, right there, right at the top of the stomach, the pyloric sphincter at the bottom of the stomach, so that's 3. And then we have the ileocecal valve, that's 4. And then we have basically the anus is 5. But if the anus has 2 parts, anyway, same thing. Accessory organs or adnexa. See, the accessory organs just are the ones who help out with digestion. That's going to be the liver, which makes bile, the gallbladder, which stores bile, and then it pushes the bile out, and then the pancreas, which is your main gland, which has 2 parts. It's actually a endocrine gland and an exocrine gland. So it's a little like fatty looking thing. It's kind of like a long triangular shape attached to the duodenum. It receives some of it. It joins up with the gallbladder, the vesicle is what it's called. Vesiculitis would be like gallbladder or a bladder inflammation, cholecystitis. Okay, those kind of things. Liver, hepato, we talked about that one. So location is below the diaphragm on the right side, right upper quadrant. Okay, or I guess it would be the segment would be the region actually would be the right hypochondriac region. Okay, in that area. There are different lobes to the liver. Okay, so it has different sections to it. They produce bile. Bile serves to emulsify fats. What does emulsify mean even, man? What does it mean? So if you've been doing dishes, right? And let's say you had spaghetti the night before. And when you put all the spaghetti pots and all that stuff in the dish with water and it gets that like orange slime layer on top, that's all oil, right? And then you pour, because you need more soap, you pour a little bit of dishwashing liquid right in there, and then the soap the soap goes in the water, and then the fats just disappear. That's emulsifying. What it does is it separates those little things so that we can break them down into smaller bits. Bile is made by the liver, okay, of bilirubin and cholesterol. Where do we get cholesterol? Where do we get bilirubin? Bilirubin comes from, it doesn't say here, but bilirubin comes from the recycling of blood. Okay, when we recycle blood, remember blood travels through the system. for about 120 to 180 days, little red blood cells, and then they go to the spleen or the liver to get recycled. They take out the iron, they take out the bilirubin and the biliverdin, and that's what does a couple things. One, you start making bile and some other things from that, and then two, some of it goes in to make basically the color of poop. Cholesterol is made also by the liver, so we really don't need cholesterol in our diets, obviously. There's some medicines that kind of mess with that. If you don't have enough cholesterol, you can't make some hormones and you can't make some neurotransmitters, which is very important, because if you don't have those, your body doesn't work well. So sometimes when people have a little bit of high cholesterol, they're giving them too much of the medicine and reducing the cholesterol too much, and that can mess up later on down the road. Bile in the liver goes to the bile ducts, goes to the hepatic duct, joins with the cystic duct from the gallbladder to form the common bile duct. Okay, colico is what it's. Empties the bile into the duodenum, the duodenum. The gallbladder, cholecystitis or cholecystosis. So gallbladder problem is cholecystitis. Okay, like a pain, upper quadrant pain, especially after eating fatty or greasy foods, fried foods and stuff like that. The easy way to fix it, a lot of times they take out the gallbladder. It's very easy to take out because you can find it really easy. It's an empty organ. You just take it out and staple off the ends and you're good to go. Now, what happens with that? Since the gallbladder is a storage vesicle, right? It just stores bile until fatty foods get into the gut, and then it squeezes out this bile, and that helps break apart some of the fats, and we can absorb the good stuff. Now, if you don't have a gallbladder, it's constantly making a little bit at a time. That's it. That's all. So you still have to reduce your fatty foods and your greasy foods afterwards. So I mean, why not just do that before? Sometimes it gets pretty bad though. Location description, we have the upper right quadrant or the upper, hypogastric, right hypogastric region. Stores bile from the liver. Yep, okay, role of cholecystokinin. So cholecystokinin. Cholecystokinin means, okay, chole is, we're talking about the gallbladder, and cysto, it means the cyst or the cells, or like the gallbladder itself. Kinin means to get it to move, so gets it to squeeze. That's what it does. Okay, pancreas. Pancreatitis, very, very painful. Pancreatic cancer, very, very bad, very, very quick, very painful. Location, it is kind of central epigastrically. It's right in the middle. It is attached to the duodenum, so it's right underneath the stomach. Exocrine function. Exocrine, so when you see exocrine or you see endocrine, it doesn't say endocrine in here, does it? Not yet. Okay, so it has endocrine and exocrine functions. So exocrine means outside of the bloodstream into what's called the lumen or the intestinal opening. Okay, the tube that is the intestines. If you could walk down your tongue and just keep going down, you'd see this, you'd be walking down a tunnel. That's the lumen. Now, if you see stuff squirting into the sides, that's like the mucus and stuff, that's an exocrine action. If it's endocrine, you have to be inside the bloodstream, okay? Exocrine, it's going to release amylases for the digestion of carbohydrates into sugars. It's going, with sugars and carbohydrates kind of synonymous, but you're going to take starches, turn them into carbohydrates, and then eventually into sugar, which is glucose, sucrose, glucose, and fructose. Those are all the sugars, okay? The proteases it's going to make are going to break down proteins into amino acids. So you have to bring proteins in, break them down to amino acids, then rebuild other proteins. Technically, you don't need proteins in your diet. So people say, well, how do you survive? Because amino acids are kind of everywhere. You can find them in all of the foods. If you're like a vegetarian, you really make sure you're having them. You have what's called the three sisters, which is rice, beans, and corn. You have those three things that kind of gives you all the amino acids, because amino acids, building blocks of proteins, are of two forms. There's essential ones that you need from the outside, and there's non-essential, which your body kind of makes up from other things it can get. Lipids, which are fats like oils and greases and lard, butter, and whatnot, get broken down by lipase. Okay, broken down to certain kinds of phosphates and certain kinds of lipids, different kind of fats. Okay, pancreatic enzymes enter the duodenum through the pancreatic duct and empties into the common bile duct. Good. Oh, pathology, problems that can happen. Now, there's tons of problems. Many of them can be transient. Some kind, which transient means they come and go, right? Or paroxysmal. Some can be chronic, which means they've been around a long time. Okay, so terms to the upper gastrointestinal complaints: um, pyrosis, hiccup, singul, oh, singultus. Okay, singultus. I've had, we don't use. Hiccups are fine. Borborygmus is a sound of your stomach going rah, rah, rah. That's borborygmus. Dyspepsia. So look at the word Pepsi. That's where the Pepsi, the drink, comes from. It used to be a digestive. So you would go to a back in the old days. You can still see one. There's one in New Orleans, near Bourbon Street, I believe. It's a soda shop, and they have what's called a soda jerk, and they would jerk the little thing and put some syrup in some seltzer water, and then they would add a bunch of herbs, and so you'd go there for a pick me up, and you'd have cocaine, put in your cola, right? Or you would have Coca-Cola, or you'd have Pepsin, okay, a little digestive enzyme in your Pepsi after having a big meal or something like that, help you. Dr. Pepper had like 23 or 32, I can't remember, different ingredients. It was made in a pharmacy. So all of the 7 Up, same kind of thing. All of these things, all the soft drinks we have, hard drinks or alcohol, right? Soft drinks are like medicinal. They were originally, and then they just became common use. Okay, eructation is a break apart of the tissues. You can have like aphthous ulcers, which are like canker sores. Halitosis, bad breath. Okay, pyrosis is pus. So I'll have to look that one up. And then hiccups. Okay, terms related to upper nausea. Now, when you throw up, there you go. It is vomitus. It is the vomitus that you emesis. Hematemesis is blood, throwing up blood. Not a good thing. Regurgitation, also not a great thing. So you have a verp, which is a vomit burp, like, ugh, and you taste it and stuff comes up. Very common thing. That can happen because of GERD, gastroesophageal reflux disorder. Okay. Nausea and vomiting. You don't use N and V. You put nausea and vomiting in your notes. N and V, nobody else would know what that means. Terms related to lower, constipation versus obstipation. Constipation is slow. Okay, so you should be going to the bathroom how many times a day? Every time you eat, or so. If you're eating more than this much in your hands, you should probably go into the bathroom at least once, right? That makes sense. Otherwise, where's it going? You're not burning it off. Because also your body, remember, is taking dead cells, other debris, and other waste products from every single of the trillions and trillions of cells that you have and putting it into that system to get rid of it. So you're getting rid of bilirubin and biliverdin and cellular debris and bacteria and pus and all kinds of gross stuff. And the foods that you can't eat, the fibers, the insoluble fibers, which means you can't absorb any of them, some other bits of this and that, probably plastics and all kinds of stuff. So you can get constipated, which means there's not enough water in the large intestine, and everything dries up basically, and it's hard to go to the bathroom. Obstipation, not going at all. Usually you have to get in there and someone has to pull it out. Okay, you can go in there and do a procedure where they go in and they can do an enema, and if that doesn't work, then they got to get in there and dig out. It's a bad deal. You got to drink water. Water is a good thing. Diarrhea, too much. Number one killer in the world is diarrhea. Look it up. Flatus, which is farts. That's all it is. Gas. Why does gas happen? Your enzymes aren't available to break down whatever it is, and that stuff ferments inside your gut, and then it makes gas. So carbohydrates are what do this most. So fibers, sugars, dough, certain kinds of grains and stuff like that can give you gas. Certain kinds of vegetables, because you can't break them down. So the fiber gets in there, it ferments, it makes gas, and you got to get the gas out, right? It comes out one way or the other. The second one, so if you eat a bunch of fats and those don't get digested, they become rancid. Rancid oils are very, very poisonous. They're not good for you. They'll make you feel terrible. And the third one is proteins. So proteins become putrid. You've smelled putrid if you've smelled a dead animal before. It's not a good thing. We don't want that stuff inside us. We want to get get things out. Hematochezia. That's a kind of bloody, little bloody stool kind of stuff. Melena is dark Melena is dark colored stool, basically, like a brown sticky. It's the first part of when a baby's born too. Irritable bowel symptoms, IBS. Irritable bowel means you go from constipation to diarrhea to constipation to diarrhea to constipation to diarrhea, and then a lot of trouble inside there. Terms to congenital, okay. Atresia means that basically the esophagus comes down and stops. They either have to open it up or reconnect it if they can find a way to surgically do it. It's pretty rare. Cleft palate, very common problem. This through here, there's two bones through here that make up the palate, and those don't grow all the way together as an infant or as a fetus, and they have to have them surgically repaired. Very, very common. If you look at Joaquin Phoenix, he has a scar right here because he had a cleft palate. You can see it in a couple different people. Congenital Hirschsprung's disease and megacolon and pyloric stenosis. Stenosis, remember, means like a narrowing of. Hirschsprung's disease, you can look that up. I wouldn't worry too much about it. I can't remember off the top of my head right away. Oral cavity, aphthous stomatitis. So aphthous ulcers. Stomato means mouth, right? And itis, stomatitis, is inflammation. Aphthous ulcers are canker sores, okay? Cheilitis is swollen on the lips, and chelosis is like chapped lips, basically, you could say that. Oral cavity disorders, malocclusion, so it doesn't close normally in some way. That's where we have either orthodontists or periodontists or something like that to work with. Dental caries are cavities, and dental plaque or plaque. Dental plaque is the stuff that your body builds up. Now, it can be calcium based too, so it's pretty tough to get rid of, and you have to scrape it off. That's what you guys will probably be doing if you're going to become dental hygienists. Terms related to oral cavity disorders, herpetic stomatitis. So herpes is a super common, it's endemic. So now there's pandemic of the whole wide world, right? There's epidemic, happens a whole bunch all at once. And then there's endemic. Basically, almost everybody already has it. It's super easily transferred. It's non harmful. You're not going to die from it. It doesn't give you other things. It's common. Most people get it as little kids because they're running around putting everything in their face, or moms transfer it to kids and stuff like that. So it's a very common thing. And luckily, our systems have um, adapted to it pretty well, and we've been able to survive these kind of things. Now, herpetic kind of things, which is a virus, can kill different things like horses or ducks or something. There's different herpetic things that can kill those animals. Okay, so leukoplakia. Leuko means white, and white plaque. Okay, on the inside of the cheeks. Now that could be part of either like yeast infection or what's called thrush. Okay, we don't want to get that. That's a bad thing. Terms related oral cavity disorder, periodontal disease, gingivitis, swollen. Okay, pyorrhea means rhea means to flow. Okay, it means flowing. And pyo means fire, so it means, or pus. So we have pus moving out of an infection, maybe an abscess or something. Terms of disorder of the esophagus, achalasia, cardiospasm. Cardiospasm? Huh. Achalasia is like it's hard, painful when you're swallowing, and it goes down. Dysphagia, same kind of thing. Difficult eating or painful eating. Phasia means eating and swallowing. There's it is, GERD, gastroesophageal reflux disease. Gastroesophageal reflux, stuff comes back up. Disease or disorder, okay? And usually it happens when people eat too late, their stomach's too full, they don't have the enzymes, their gut is all full and everything's backed up, and it pushes on the cardiac sphincter, and then some of it comes back up and you get like those nasty burps, okay? Gastralgia, gas pain, okay? Gastritis, inflammation of the intestine. Peptic ulcer, so peptic, right? Peptic area, okay? That's like the lower in the stomach, okay? Ulcers. Now, that used to be the number one problem with people was like ulcers. Like people get ulcers all the time because you stress out. Right? Don't worry, you'll get an ulcer. Now we don't see that as much. People take enough stuff, and usually you would have to take some kind of like Tums or something like that, which is calcium based, which is interesting because calcium reduces acid. So you're reducing acid in the stomach. Is that a good idea? Sometimes. But if you were doing it with eating, then remember we're talking about like your digestion process can't go on because you can't start the first part of digestion. You didn't break it down. It just sits in your gut and rots. That's not good. Okay, appendix, appendicitis, and acute peritonitis. So appendicitis is an inflammation of the appendix. Remember the appendix attached to the cecum, the first part of the large intestine in the lower right-hand corner, the lower right quadrant. Okay, it's the vermiform. Remember, it looks like a little worm. And what it does is they used to say, "Oh, it's useless, so cut it out." Now, why on earth with whoever you believe in, the creator, God, whatever, or just the universe itself, it being like somewhat intelligent, why would it put things in you that are useless? It doesn't make any sense. So you can pull it out and you can survive quite nicely, but it is part of the lymph and immune system, and it actually holds a little bit of the bacteria that should be normal in the gut, and it can re-inoculate and bring those guys back if it needs to bring, like, it's like support troops basically. Acute peritonitis, if you get stabbed in the belly. Okay, so here's one thing, like the old TV shows, the old movies, they would have the cowboy get gut shot. And oh, he's gut shot, he's gonna die, because you die of a peritonitis. Okay, the peritoneum, remember we talked about that before. That's the peritoneal space in the abdomen, right? Inside the skin is a wall, okay, inside there. And that wall is called the parietal peritoneum. And then you have the parietal space, or the peritoneal space, and that has serous fluid in it. And then you have the serosa, which is the visceral peritoneum, which is wrapped all around the gut. Okay, the gut's all twisted up inside you. You know, it's organized and it's held together with a mesentery, so it's not just you don't get it in knots. It's in there pretty good. Now the end of the system, the intestinal disorders. Can we see that good? Anal fissures. Fissures are like openings that go in, and they can be quite painful, and they can get infected really easy. Anal rectal abscesses. That's an infection right there. Hemorrhoids. Those are from so hemorrhoids are veins. There's internal and external hemorrhoids, and those are little veins that have basically bulged out. Now that's related to liver function as well as other issues. So if you're really backed up all the way up the system, you're more likely to get hemorrhoids. Also straining when you're in the bathroom, that also gives hemorrhoids. Proctitis, inflammation, and then inflammation of the proctal area, or that's going to be that whole area. It's called the perineum, underneath there, and it's also the anus and stuff. So when that swells up, that's proctitis. Pruritus means itching. So you can have pruritus anywhere, but this is pruritus ani. That's your scratchy little butthole, or itchy little butthole. That's what it is. Terms related to intestinal disorders: colitis, inflammation of the colon; Crohn's disease. So not Crohn, it's Crohn's with an apostrophe. Crohn's is a proper name. Okay, so it's Crohn's disease. And Crohn's disease is a series of different inflammatory things going on inside the large intestine. Related to IBS, it's just a little bit more specific, okay? IBD is IBS, okay, inflammatory bowel disease. Inflammatory bowel syndrome, whatever, it doesn't matter whichever one you use. Ulcerative colitis, so inflammation of the colon and ulcers inside. Those aren't good. Okay, next thing you can have is, oh, here we go. You can also have polyps in the large intestine. Now, when you do an endoscopy, like they go up through the bottom with the camera and they can look, they fill it up with air, they get everything out first, right, the day before. Then they fill it up with air, they put a camera in there, and they look around and they see all this kind of stuff. If they see diverticulosis or diverticuli, means it's diverted. So you have the tube, right? And there's a little outpouching that has a little pocket. Now that can become just filled with nothing, or it can be filled with some fecal matter. If it inflames, it's called diverticulitis. Okay? Fistula is, you can have external and internal fistulas. Fistulas is an infection that it's like so if you have a diverticuli, right? So we have this is the surface of the intestine. This is the inside of the intestinal, and this is the outside, basically, or the wall. And it breaks apart here, and you have a little diverticula, okay, a little open space through here, and then that gets bigger, 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 and then this heals up again, and you'll end up with this closing off and becoming either infected or just encapsulating, and it's called a fistula. Okay, ileus. Oh, ileus is the second part of the small intestine. Remember, we have the stomach, duodenum, right? And then we have jejunum, and then ileum is the last part of the small intestine. Intussusception is where you end up, the intestinal is like this, right? It's a big tube and it folds over on itself. That's called intussusception. And you have to pull it apart, sometimes surgically. Paralytic ileus, if you get a back injury, break your back, you can get areas of that spine which don't tell the intestine to move anymore, and that can be paralytic, okay? Volvulus, oh, Jiminy Crickets, we'd have to look that one up. Volvulus. See, here's the cool part. You go this, volvulus. You look up volvulus. Obstruction, twisting or knotting. Oh, okay. Very similar to the intussusception, but it's a knot or an obstruction. Terms related to GI, accessory organs. Okay, so here are accessory organs. So cirrhosis of the liver is hardening of the liver. It happens usually because of alcohol use and just, you're giving a lot of tension to that poor liver. Hepatitis A, B, and C. C is chronic. B and A. A is from like A and B are from like food handling usually, and like not cleaning or being in contact with other people's fecal matter. You can get those ones pretty easy. Jaundice. Jaundice is a really amazing thing. And so this is a yellow highlighter. And if I colored the inside of my eyes here, the white part, the sclera, yellow, that's exactly what jaundice looks like. And their skin will have this weird yellow tone to it. It's a buildup of bilirubin in the system. Pancreatitis, inflammation of the pancreas, usually also from alcohol abuse, basically, and can be very, very painful. And the pancreas turns on itself and starts digesting its own tissues. That's very, very painful. Cholangitis is gallbladder pain. Cholecystitis is gallbladder inflammation. Cholelithiasis. So whenever you say lithiasis, means stones. Okay, cholelithiasis. So this is truly gallbladder stones. This is gallbladder stones along the tube too. Don't worry about that one too much. But pain, angiitis, okay, angina. Remember you heard that one. Cyst, okay, so cyst is this is the cyst means basically the container, and then chole means the gallbladder. So we have the gallbladder container, inflammation, itis, right? Okay, lithiasis. Okay, lithiasis means stones. Okay, so you can have cystolithiasis, so it's like bladder stones. Nephrolithiasis, we can have kidney stones. Okay, terms related to hernias. Hernias, okay. Umbilical. So here's the different places. Femoral hernias happen underneath the femoral, underneath up in here. Okay, and then you have hiatal hernia up here in the stomach. Okay, that happens where the stomach reaches the hiatus of the diaphragm. The diaphragm is a umbrella-shaped muscle right underneath the rib cage, right? So it separates the thoracic cage on the top, with the abdominal pelvic cage, and that diaphragm has a thing called a hiatus. Hiatus just means opening. That's what it is, or a space, right? And so your stomach will push through that one. That's called a hiatal hernia. Inguinal hernias happen down through here, down underneath. Okay, above or below. Those are the two problems. Now, inguinal hernia happens down here in the inguinal area. This is usually males. Femoral hernias happen usually in females, can also happen in males. Females don't usually get the inguinal hernias, and here's why. Okay, so there's a little loop right in through here where the spermatic cord goes to the testes from inside. Females don't have that, okay? Umbilical hernias, oh, that's a belly button. Okay, you end up with an outie for some reason, whatever. It usually happens in babies. Terms, incarcerated hernia or strangulated hernia. Incarcerated means it's still inside of everything, and strangulated means it's popped out, and then you're strangulating that bit of intestine that's pushing out of that tear, if you will, and that's bad, and you can get necrosis, and then you can get peritonitis and die. Benign neoplasm cystadenoma, leiomyoma, odontogenic tumor. Odontogenic tumor is odontist. Okay, so up here, leiomyoma, that's going to be, so we're back in bone marrow area, or it's kind of the inner myoma. It has to do with what's going on here. Myoma has to do with it. So we're looking at muscle, like muscle marrow, internal muscle. Cystadenoma, that's going to be adenoma. So you look at adeno, okay, it means gland. Oma means tumor. So a gland tumor somewhere near the cyst, which is going to be your gallbladder. Okay. Polyps, adenomatous or hyperplastic. Sessile versus pedunculated. Wow. Sessile versus pedunculated. You're going to have to look those two up, sessile and pedunculated. Not very commonly used. Adeno, now we know that means gland. Carcinoma, a gland cancer. Hepato means liver. Hepatocellular, so liver cell carcinoma or hepatoma. Hepatoma. Squamous cell carcinoma. Squamous cells, flat cells in the epithelium. What's epithelial? The entire digestive system. The whole alimentary canal is all epithelial. Now the age matters. Congenital disorders. So the congenital disorders can be like the atresias, like the esophageal atresia, the certain what is it? Cleft palate. As we go through back in through here, extra teeth, no teeth, tongue problems. You can have, like I said, esophageal atresia, esophageal problems where it doesn't connect. You can have other areas like hernias and stuff like that can happen. Gastroenteritis. That means inflammation of the gut. That's like gut pains. Little kids get them all the time. You know, I mean, like colic is a gut pain, is what that is. And appendicitis usually in smaller kids because they don't have the immune system to fight as well. Really, that's what's going on. The gut, remember, the large intestine holds all of your a large portion of your biome. Okay, what's your biome? You gotta look up. There's a biome video by NPR. It's spectacular. I'll try to send it to everybody. I think it's really good to learn because that's the future of a lot of medicinal stuff. So a lot of your bacteria that are friendly are in your gut. Serotonin, the feel-good chemical, 80% of it created in your gut. That doesn't go to the brain. That's part of the digestive process and part of the make you feel good through the nervous system. Geriatric, old people, neoplasms, cancer. Gastroesophageal reflux disease, dysphagia, difficulty swallowing, hemorrhoids on the bottom, type 2 diabetes. So over here, pediatric, we have type 1 diabetes. And so let's look at diabetes for a second. I don't think this has any more, does it? Okay. Diabetes, so we have different types. Type 2 diabetes is adult onset. Type 1 is juvenile onset. Usually it has to do with the pancreas, right? The pancreas can't make insulin. Insulin is a hormone that your body makes to help sugar get into cells. It's like a key. You make a bunch of keys, the sugar gets into the cells. You don't make them, it don't go in. If you don't make enough insulin, then your blood glucose gets higher and higher and higher. Some of you may have this. You know people who have this and have to check their blood. They do the finger pricks, check the blood, see what their glucose level is. It should be about 100, 120 grams per deciliter or something like that. Or 180. 180 is, I think above 180 is not good. I can't remember off the top of my head. But as it gets too low, that means that like either A, you're not creating enough sugars because you haven't eaten, or the insulin's so much that it's like pulling in all of the sugars and you can't have any for like the brain to use, so you get tired and can go into a coma. So what's the thing to do, at least on the outside the hospital, is to give them some sweets, like some orange juice. If they can hold it and drink it, they can have it. If it's too much sugar in the bloodstream, that means that the insulin isn't working, right? The keys aren't working for some, or you're not making keys. So you supplement with an injection of insulin. There you go. Now, type 2 diabetes, usually when you see that, you can usually change that with diet if caught early. Mellitus, what does mellitus mean? It means honey-like. Okay, the root word has to do with honey, so it's like sweet. So when you urinate, you get a few different things. Sweet urination, like it's sweet pea, basically. So that's like you get one of the things they used to do back in the old days, they would set urine out, right, and see what it does. If it gets cloudy, that means there could be problems with it for some other disease processes. If flies come to it, that means that there's proteins in your urine because they like that stuff. If ants show up to it, that means there's sugar in your urine. So that means you have diabetes. That's a very, very, very old way of diagnosing. We don't do that anymore. Now you can also taste it, but I suggest not to do that. That's very, very, very old. Ugh, gross. So it would actually be sweet because you have sugar getting through the system, through the kidneys, out through the urine. So that's how we check it. Now we check it with like strips that can tell how much sugar is in there. That's a very, very good thing for urinary tests. Too much to know. Diagnostic procedures and therapeutic interventions. Let's see. Oh, okay, whatever. Terms related to imaging, barium enema. Enema, that's up the bottom. Okay, barium swallow, that's down from the top. So you take this stuff called barium, and it's basically like a kind of a pasty kind of liquid. You swallow it down, and then you can see what's going on in an X-ray if that barium fills that tube evenly, or if there's a little out pouches. You're looking for like the diverticuli or some of the diverticulosis, diverticulitis, that kind of thing. You can see that in the large intestine. You can see an atresia or an intussusception where it's folded over on each other, those kind of thing. The cholecystography. Chole, remember we're talking about, when we talk chole, we're talking gallbladder, cholecysto, it's gallbladder right there. And then graphy means to check it or look at it. Okay, endoscopic retrograde cholangiopancreatography. Wow, cholangiopancreatography. Okay, so we're looking at what? So endoscopic, we're putting a camera inside someone. Retrograde means backwards, basically, through the back end of it. Choleangio. So chole is, again, we're looking at gallbladder. Angio, vessels. Pancreato, pancreas. And graphy, looking at. There we go. Okay, computed tomography, CT scans. Really good to see the internal organs on the CT scan. Endoscopy is putting a camera. Manometry is checking the space inside. And sonography is using sound. Percutaneous transhepatic cholangiography. Wow. Percutaneous, so through the skin. Transhepatic, across the liver. Cholangiography. So cholangiography, we're looking again at the gallbladder. So we're looking at the through this, so through the belly, probably I'm guessing, you'd have to look it up, but I'm guessing a ultrasound. Okay. Now, next one, laboratory test, biopsy. We get in there, we take a piece of it. They do that commonly with your endoscopies. They get in there with a little pincher and take a little piece, and then they send it to a lab and see what's going on there. GGT, gamma glutamyl transferase, doing tests on the chemicals. Stool cultures, so they take some of your poop, and then they see what grows. They see what bacteria grow. If there's fungus that grows, if there's other things that grow. If those grow, you go, okay, positive, now we know what to treat you with. They don't do them too much. Guaiac hematocal test. They look in to see if there's any blood in your stool. And then total bilirubin. Bilirubin, remember that tells how your blood's being recycled and whether the liver's working. So that's going to give you some liver function tests. Anastomoses. Okay, so therapeutic interventions, stomy, anastomoses. We're going to put a hole in it, basically. Okay, let's look up anastomosis real quick. I don't know if it'll actually let me do this. Anastomosis, cross connection between adjacent channels. So if you have like something wrong with your gut, they'll just reconnect it somewhere else. Go. Terms using single structure. Geez, my gosh. Bariatric, colostomy, stoma, enema, and gastrectomy. Take out your stomach. Hemorrhoidectomy. They cut out your hemorrhoids. Ugh. Herniography. They look at the hernia, or they graph, they measure the hernia. Laparoscopic surgery. Lay you on your back, looking through the belly, usually from the bottom and going up. Cholecystectomy. They take out your gallbladder. Cystectomy. Ectomy. Ecto to take out, to cut out. Okay. And a trocar. I cannot remember for the life of me what a trocar is. See how these things, I mean, you just forget. Oh, what the heck is that? Okay. Oh, there we go. Why would I know that what that is? A trocar is basically you put a hole in the gut, and then you put a thing in there that you could stick other stuff in. It's a tool. Okay, a trocar. That's why would we need to know that? You'd learn it later, but a trocar is a tool that helps you put other stuff into. It's like a funnel, right? A funnel. You put other tools in, so it's smooth, easy to get into. Laparotomy, open up the lap, basically, the belly. Ligation, like is to cut. Analysis of adhesions, they cut them away, basically adhesions. Nasogastric intubation, a tube all the way through here into the stomach, and that's where they do a feeding tube. Paracentesis and pylorrheotomy. I'm looking that one up too, because dang, can I do that? Oh, there we go. Pylorrheotomy, surgery to repair the pylorus. Okay, so the pylorus, the end part of the stomach. You can look it up. So here's how to do it. You highlight it. Oops, you highlight the word, you right click, you hit copy, you bring it to another window, you put it up in through here. Where is it at? Oh, I can't see it very well. Oh man, why did that thing get all messed up? There we go. You put it up there and you search for that. Okay. Let's odontectomy, polypectomy. Let's see what that is. What's a polypectomy? Oh, polypectomy. Wow. See, okay. See, this is important. So when you learn the cadence of the words, you're all poly. See, I was looking at poly first, which means many, but not polyp. Okay. Polypectomy. So ectomy is the cutting out of, right? And the polyp is a polyp, right? There's a little growth. So you can cut those off. That's called a polypectomy. But a polypec. So I was reading it wrong. I was going poly means many and pect means chest. So that doesn't make any sense. That's why a lot of times it has to do with the idea of what we're talking about already. Okay, stomatoplasty is fixing the stoma, which is the mouth, really, basically is what that is. Gastric lavage, gastric gavage. What's gastric gavage? I'm gonna look that up. Hang on a second. I think it's lavage. Oh, okay. So they do gavage is to do with the tube. Okay. Stomach tube, internal nutrition, PEG tube, ooh, parental nutrition, hyperalimentation. Wow, these are a lot of words that I've not been exposed to. Okay, artificial supply of nutrients, that's why. Okay. So these are people who are on IV fluids and IV foods, basically. Okay, these are IV stuff or tube related things. If you're really injured and you're on a bunch of tubes, some of these are going to be doing this. Okay, they'll tell you. Okay, anorexins. So anorexia means don't want to eat. Okay, let's see. Is this something that will make you want to eat? Suppress the appetite. So anorexin makes you not want to eat. Okay, so anorexia nervosa is a condition where you don't want to eat because you don't want to get fat. You don't want to eat because you don't want to feel bad. So it's common. Anorexia is a common term used for a lot of illnesses. If you get a headache, you get anorexia. You don't feel like eating. You get sick, you don't feel like eating. And remember, like in old movies too, like old stories and movies, if someone ate a bowl of soup, they're like, oh, they're getting better, they want to eat, which is a sign that you've broken fevers and stuff like that. Antacids against acids. Okay, anti-diarrheals keep you from pooping yourself, basically. You know, it's all fun and games until that happens. Anti-diarrheals like bismuth is an old kind of like mud actually would be used in different ways, different kinds of mud. Bentonite clay is one that you can use for this kind of stuff. Antiemetics keep you from throwing up. Cathartics. So having a catharsis means you're like, whoa, something came out of my brain. So laxatives and purgatives. So you're just getting rid of stuff either from the liver or the large intestine. Okay, laxatives make you go poop. Laxatives and purgatives that we can see we have are Cascara sagrada, which is an herb, or senna, which is also another herb you can use. You can use vitamin C, large quantities of vitamin C over 2,000 milligrams. That's a good one to do. Histamine receptor antagonists. And so if you're having a lot of inflammation, you would use these. And a proton pump inhibitors would also help with. That actually helps with the acid making. So protons, we're thinking of hydrogen again, right? We're thinking back in pH land. Anyway, that is, oh, geez, that was a long one. That was 50. How many was that? That was a lot, man. 55? That was 55. Boop. That was 55 different slides on gastrointestinal chapter 5. So we're going to continue on. Remember, this is week 4. You guys have already finished the midterm. You're doing great. It's on the downhill slide. This is the easy part. It does take a little while to do it. So we're going to post this one today and go from there. You guys take care, do your homework, and let me know if you're having problems, and we'll see you on the flip side.